Hey everybody, I am doing a 10-minute video project for my physiological psychology class. My project is going to be on strokes. I'm going to give y'all the definition of a stroke, what kind of strokes there are, treatments for strokes, and how to prevent strokes. So just a general definition of a stroke is a blockage or interference with blood flow into a certain area of your brain. So the area that's restricted determines what will be damaged. So if you have a stroke in your frontal lobe, which is in charge of decision making, critical thinking, then you'll have difficulty with those things after the stroke. So one big thing about strokes though, and I'm going to keep reiterating this throughout the video, is the more quickly that you realize there's a stroke happening to yourself, then the faster you need to act, because the faster you act, the less damage will occur. So there's just two types of strokes. You have an ischemic stroke, which is a stroke that has been, which is a type of stroke where the blood vessel is clotted, so it's restricting blood flow to those areas. So you have a clot and no blood can be pumped into those areas. So then you have the second type of stroke, which is a more rare type of stroke, is the hemorrhagic stroke. So it's like a hemorrhage. So you have bleeding out of the blood vessel into the surrounding tissues, which really damages things. So a common hemorrhagic stroke type that you may know is an aneurysm. So that is like a balloon-like structure in the vessel, and that could rupture and hemorrhage into the surrounding tissues. But about 80% of strokes are ischemic strokes, so that means there is a clot. Usually the doctors can go in and remove that clot fairly easily. So the fastest symptoms of strokes can be identified quickly. Some of these strokes are like the drooping of the side of your face, excuse me. You have like slurred speech. Your one side of your body is sluggish, so your brain works like bilaterally. So your left side controls your right side, and your right side controls your left side. So if you have a stroke in your left hemisphere, say your left frontal hemisphere, then you're not going to be able to control movement on the right side. You're going to have a difficulty with that movement on the right side. So just say again, the faster you recognize a stroke, the better. Those were just fast symptoms that occur very quickly: the speech, the drooping of the face, and the sluggish side of your body. Other more serious stroke signs is going to be like dizziness, loss of coordination, some headaches. You're not going to be able to see very well. So those are things that will progress the worse the stroke gets. So key thing, if you feel like your speech is getting slurred, or you feel like there's those fast signs of strokes and you need to act immediately, the longer the stroke progresses, the more involved the symptoms will be. So you need to be proactive. So according to our physiological psychology textbook, 50% of strokes are preventable. And if you understand how to prevent those strokes, then you'll be a lower risk. So that's always good. We should always be very proactive in our health, because, your body is the temple. If your health isn't there, then you're not going to be here. So I want everybody to be here. I want everybody to be, safe and healthy. So let's just take that into consideration. So according to like stroke.org, there are 3 key steps in preventing strokes. So, just maintain these prevention techniques. So the first step is to identify the common risks of the stroke and your personal risks. So just like basic knowledge about like how strokes occur, what kind of lifestyle choices you make that make strokes more of a risk, and also your personal risk, like your family history, your background, which I'll talk more about that in the end of the video. And then the second step on stroke.org. So the first step was, make sure that you understand the common risk and the personal risk. And secondly, you need to reduce your risk factors. So you need to participate in those activities that lower your risk for a stroke. So this would include like monitoring your health, obviously, and living that necessary lifestyle to maintain that low risk. And then the third and final step that stroke.org gives is like recognizing and responding to signals and symptoms. So that incorporates those fast symptoms like drooping over face, slurred speech. The other one side of your body is more sluggish. So those are very fast symptoms that you should be familiar with and be able to recognize, just in case a stroke was to happen to you. So helpline.com provides a list of ways to prevent strokes. So these are pretty basic. I mean, you probably already know, but just to reiterate, excuse me, increasing your physical activity is very important. Eating a healthy diet and maintaining your healthy weight based on your height and age. You should reduce binge drinking and only drink a limit amount of alcoholic beverages. The website recommends 2 alcoholic beverages per day for men and 1 alcoholic beverage for women. So women, I hate it, but we have to, we get less because our body weight is less. But, also not engaging in smoking cigarettes, marijuana, any illegal drug activity could increase your risk for strokes. You also need to understand your blood pressure and your blood glucose levels and monitor those, because if they, elevate, then that will make your risk of a stroke much higher. So the average healthy activity level for just an average adult is going to be between 30 and 45 minutes a day. So, just make sure you're getting out there and just walking around. Like, do something that you enjoy. Don't be miserable when you're working out, because then you're not going to really benefit much from it. You're not going to want to do it. So I also have some calorie recommendations. So average woman is supposed to consume 2,000 calories per day, and an average man is supposed to consume 2,500 calories per day. So I hope I said 2,000 and 2,500. 2,000 for women, 2,500 for men. But and that's making sure that you have a healthy diet. I mean, going to Wendy's, which I'm very guilty of, very often is not a very good diet. So we should make sure that we incorporate those food group items like dairy, fruits, vegetables, meat, and bread. So also, I just have a body mass index calculation. There's a website called rush.edu/health-wellness. So you can get on there and you can type in your height and your weight, and it will calculate your BMI for you. A healthy BMI that you should maintain to eliminate that risk of stroke is between 18.5 and 24.9. So that's the BMI range that's healthy. Once you get over 24.9, you are overweight, and that makes your risk of a stroke more. It's very important to understand your family history, because if you have high blood pressure, diabetes, or heart disease in your immediate family, then your stroke risk will be higher. So just make sure that you understand, what those family issues could, incorporate into your own life, and just be proactive in understanding how those things occur. Also, as you age, your stroke risk increases, and according to the National Heart, Lung, and Blood Institute, stroke risks are higher for African Americans and American Indians compared to white, Hispanic, or Asian Americans. So just keep that in mind. Also, I'm guilty of this, but unhealthy levels of stress are very bad for your blood pressure and your heart. So you need to make sure that you monitor your stress and depression, because that can make your risk of stroke higher. So treatments of strokes are very important. Just be proactive, but be proactive in prevention, but there are treatments available. Doctors have some stroke treatment techniques that they can use. So they have 2 types of techniques. They can go in and remove the clot, or they can give you medications for the clot. These treatments are scary because, when you go in and you mess around with your brain tissue, that's not very good. I mean, my grandmother, she had an aneurysm, and they went in and coiled it, which is great, but they hit her optic nerve, so she lost sight in her left eye. So, that wasn't a huge deal, but it was something that she had to deal with, for the rest of her life because of her clot. So, all this information provided, is very important, and I should take this, you all should take this and try to incorporate it into your own life. It's very important for us to live long, healthy lives. So as long as we're proactive, we should be good. Thank you for listening. Bye.